course, the title speaks for itself. Physical therapy versus occupational therapy. We are not here to debate. We are not here to see who is right and who is wrong or anything like that, who is better and who is worse. It's nothing like that. We are all members from the health care team, but we want to explain how each one of us has a role, specifically here, because we are here in a neurology hospital, so we might give some examples from the neurological conditions. But in here we want to clarify how can you differentiate between occupational therapy and physical therapy. Let me start by asking you frequently asked questions. Tell me, what kind of a question that pops into your mind when you're thinking about physical therapy and occupational therapy? What gets you confused? Any question? You don't have any wonder why you are here today? Why you are here today?
To know the difference between
There is no point. You will not have CME for attending this session, right? Okay. But there is a purpose for you to come to here. Why?
I need to know the difference.
You know the difference. Okay. Any other question? This is the only question?
How to cooperate together to improve the results.
How to?
Cooperate together.
Okay. What else?
What type of contact? Is it inpatient, outpatient? Is it community-based for both of the specialties?
Okay. So, we put some questions here that probably is popping into your mind, but you're not loudly saying it. Are PT and OT the same? This is one of the questions. Maybe OT was originated from PT? Okay. And if they are sister courses, they should run parallel, but why is there an overlap? There is an overlap, and we will clarify this. And how and when should be one consulted? When you seek the help of physiotherapist, and when to seek the help of an occupational therapist. Okay? And of course, should we work simultaneously or different sessions? Are we totally separate? Should we have joint sessions together? We should never do that. How come? And lastly, how can we solve issues between the two? Okay? I hope there is no conflict. So the content, we will go over an overview from the whole thing, a history about both professions, education, the function and mood of the treatment, specialties and subspecialties, documentation and assessment, outcome measures, and of course the treatment strategies. And at the end, we will summarize everything for you. Okay? First, we would like to start with a little drama of therapies. We exaggerated a little bit. Okay? It's not actually true, 100%. But we would like you to have an idea, probably from what is inside thinking to the outside. So we have our starting today, physiotherapist and occupational therapist. Okay. Allow me to introduce them for you. We have our colleague Ashraf. He is a physiotherapist and he is playing in this show as a doctor, a physician. Okay. We have Maya, our colleague here. She will be playing the patient. She will be the patient. Okay. And we have our colleague Abeer, Sabiti. Okay. Abeer, she will be the physiotherapist as the actual role in life. And of course, Duha, she's an OT, and she will be playing the OT. And now we have a little surprise for you. The little devil. Okay? He will be spreading some lies. Okay? And he will try to bring each other against one another. But he will be invisible for them. You will be the only ones who are seeing him. Okay? So whatever he says, you can hear it. They can hear it inside their mind, but they cannot see him. Is that clear? We have patient, doctor, and of course, the PT, the OT, and the dental. Okay? Are we ready? Yes. We're going to the scene. Okay. Start. And 1, 2, 3, action.
Round, sister, come please. Good morning. How are you today?
Yeah, feeling better.
How is she today? Did you walk?
Yes, she is. And also we need one person for walking due to transfer from hair bed to the WC. Yes, doctor, I agree, but she's only one person assistant, but sometimes she can work independently with close supervision.
Great, you are doing fine. You have a good team.
Thank you, doctor. Thank you.
See you.
Thank you. Hello. Hi. Oh my God, do you know this OT Jeeva? Oh my God. Doctor was asking me some question and she jumped from nowhere. Yes, doctor, she's looking. Oh my God, was asking me, is the patient walk or not? Just look at the upper limb. I don't know why she just jumped like this. Really, I cannot stand her. Yeah. Okay, let me finish my patient before she's coming. I know she will come now. Okay, we are Hi, Maya, how are you? Hi, dear. How are you today? Yeah, feeling better? Did you do your exercise? Oh, it's okay. Okay, we'll start our session today. Are you ready? Okay, we'll start with gait training. So let me bring my vegetables. Very good. We'll start our walking today. I hope that you feel fine today. Yeah. Okay. Up, with elbows. Very good. Excellent. Okay, we'll start standing. Come on. Give me your hand. Very good. Very good. As usual. Very good. Strong. Yes, very good. I'm here. Don't worry. Okay, show me the gear step. Very good. Okay, let me just remove my hand now. You're fine. Sure. I'm sure. Come on. I know you can. You hold me? Yes, I do. Come. Relax for me. Very good. Now turn. Let us go back. We finish our walking. Don't worry. I'm here. Very good, Maya. Mashallah, excellent job. You're fine now. Turn. Sit. Very good. Okay. We will do our training today for the cups. We're using the cups. We'll do some reaching exercise with the coordination. Okay. Yes, very good. We'll use your right hand. Exit one. Take it. Come. Put this one. Very good. Put it here. Excellent. Now the blue one. Over the blue one. Come on, reach. Very good.
Noah, what is she doing? Is that hand coordination exercise? Cognitive training? Why is she using your equipment? This is your equipment. She's stealing your job. Don't let her do it.
Very good. The last one. Come on, you can. This is the last one, dear. Very good. Excellent job. Excellent work today. Really did very good job. Let me remove this one. Come on, you want to lie down, dear? We finished our session today. You want to lie down? No, come on, Yalla, lie down. Maya, lie down first. Yalla, lie down. Lie down. Okay, dear Maya, I'm here, okay? If you need anything, I'm just writing my notes. If you need anything, just tell me, dear.
Oh, sure.
Okay, I'm here.
Thank you so much.
Good morning, Abeer. Hello.
How are you today?
Alhamdulillah.
How about the patient?
She's fine.
How about her vitally?
Go ask the nurse. Why are you asking me?
No, I think you have an idea.
Okay, I'm not free now. Just go to the nurse.
Okay. Hi, you doing, dear? Everything is fine?
Yeah, I'm feeling better today.
Could I start with her
Yeah,
again?
sure. I will wait for you.
Oh, thank you. Yeah, this is start now. Okay, in your hand.
Aha, here. Look, the OT is doing range of motion exercise. This is physical therapist's job. And I think now she's making strengthening exercise. This is your job. Don't let her do this. This is your job. Noah, look at the way she's looking at you. She thinks you're stealing her job. Let's see how she reacts when you make the patient stand and walk.
Okay, dear, you want to sit and then walk, okay?
Look, dear, Look, I think the OT is gonna make the patient stand. Oh my, this is your job. Oh no, I think they're standing now. I see it. I think this is making her walk. This is gate cleaning. This is your job.
Excuse me, what are you doing? It's my therapy. I just make my patients walk, so please don't have a time. Whatever, it's mine now. I have to conduct my therapy. I told you, I just make patients walk. Why don't you just come with walking? Come on, let's go. Come on, Maya,
Does that really happen in real life?
I hope not.
Okay, yeah, this is nice. Definitely nice. So what I'm showing you now the positive side of collaborating physiotherapy along with occupational therapy. This is the way it should be. This is an example of a stroke patient being dealt with an occupational therapist and also a physiotherapist. Look at how she's talking about both of them. Go ahead.
I was in Ibiza on holiday. I was walking up into the bedroom and I went around the bed. When I came to, I had lost my voice completely and I was paralysed down the right-hand side, totally. I had occupational therapy and physiotherapy to help me relearn everyday things.
There's a lot of fear that comes with some of these conditions. They just come out of the blue, and you're working with a service user at the most crucial points in their recovery, getting from the bed to the toilet, being able to go outside and enjoy a bit of the outdoors. Things that seem quite simple actually, but when you've got a condition like stroke, they're incredibly hard.
My occupational therapist helped me learn to do everyday tasks, like getting in and out of the bath again. I was very motivated, I think.
The minor things of just picking up a pen again, eating again, that is such a huge thing of gaining independence.
My physiotherapist taught me to walk. The relationship I developed with her was one of the most important relationships in all of my life. I came to UB Bristol and talked to the students about my experiences with my physiotherapist and my occupational therapist.
I'm Vicky Goldie and I'm a third year physiotherapy student at UB Bristol. As a personal trainer and doing sports massage, and I thought I really wanted to go that extra mile. How can I help someone more? Jenny was really inspirational when she came in. Seeing her that day for the first time, it made me think, this is why I want to help someone just like Jenny.
I'm Jeremy Grant. I'm a second year occupational therapy student at UB Bristol. I see a real range of options for any potential occupational therapist. We can go into mental health, we can work in a prison, in a school, in a hospital. Occupational therapy is definitely the career for me.
Okay, this is the right side, and I hope, and of course, I insist that this is the correct side. Okay, so let's get further with this lecture and tell you exactly what are the differences, what are the similarities between the two professions. To start with, about the history of PT. Anyone from the PTs, do you know when PT started?
After the
Second World War?
Okay, after World War I. Okay. That is which year? The 40s? 40s. Okay. Anybody has any other idea? Okay, actually, it started with the physicians. Hippocrates and Galileo are believed to be the first practitioners of physical therapy, advocating manual therapy techniques and hydrotherapy to treat people in 460 years before century. Okay, this is how old the profession is. And the earliest documented origins father of Swedish gymnastics, who founded the Royal Central Institute of Gymnastics in 1813 for manipulation and exercise. Okay?
So probably OT is way behind the development of PT, and it actually started with mental illness. So there were a lot of people who had mental illness. So in the earlier days, people were trained, put in very critical situations, and they were treated as a nobody. So that is when, in 100 BC, this guy, he was a Greek physician, his name was Asclepiades, I can't pronounce it anyway. So he started therapeutic baths, massages, and some music therapy, which started off to give these people some solace and help them in their day-to-day activities, like not to tie them up and treat them like nobody, but to treat them as human beings. So after that, in the 18th century, there was a moral treatment. So that's when the people from the psychiatric department were taken again. And as you see in the picture, there was like some leisure activity that was given to them. So something like gardening or doing some task, candle making. So that was when the moral treatment came into being. But OT as such became a science in 1910. So we are almost 108 years old. So Eleanor is the founder of occupational therapy. So since then, we have an association which was officially termed as the Occupational Therapy Association in 1917, and from then on, we've started off. But here in Kuwait, the school has started probably in 2008, if I'm correct. So we have our occupational therapists, Kuwait occupational therapists in Kuwait right now.
Yes. And if we move to the second point, education, and we are talking here about Kuwait. For physiotherapists, to get their degree, they have to study for 4 years, and they have a rotational clinical training for 1 year. And if you want to have a higher kind of education, you are eligible to have a master's degree, PhD, and of course a DBT, Doctor of Physical Therapy.
Similarly, OTs in Kuwait have 4 years, 6 months of training, followed by a 1 year rotation. And if they're interested, they could follow up as a master's or a PhD or an OT doctoral.
Okay. Now, as a general idea, if we talked about physical therapy, what they are focused on, we'll be talking about physical problems interfering with movement. This is the main concept of physiotherapy practice.
And OT will focus mainly on a person's quality of life and his performance. So how qualitative or how is he able to be productive in his society?
Okay. We talked about the function, the main function of physiotherapist and an occupational therapist. For the physiotherapy part, we are having actually two parts, the knowledge part, and the second part would be the skill part. And the cognitive function or the knowledge, we have to organize, prioritize, document, plan, interact, and supervise. And the psychomotor function and the skills safely, reliably, and efficiently perform required PT examination and intervention procedures to evaluate and treat the functional skills and limitations and the gross motor system of patients across their lifespan, including patients when they are infants, children, adults, and older age.
So there's a big confusion between the OTs and PTs. Like the PT says I'm improving function, the OT says I'm improving function. So there's always this argument as to what exactly is function according to physiotherapists and according to OTs. So as you've heard, what is the physiotherapy part? The occupational therapists look at function as a wider spectrum. So they don't just look at the range of motion or like a muscle strength or the cognitive or the psychomotor function, but they would look at a person as a whole. So if a person is, say he's a teacher, so if he's a teacher, what is his habits in the day? Like what time does he get up? What time does he go for a shower or his self-care? What time does he go to work? What are the steps he husband? So we look into all these aspects, not only from his personal point of view, but also in the environment that he is associated with and his performance level.
Okay. Another aspect of controversy, which is the mode of treatment. Which kind of treatment that we are using with our patients as physiotherapy?
Range of motion, strengthening.
Okay. What else? Electrotherapy. Hydrotherapy. Okay. We talked about therapeutic exercise, all types of therapeutic exercises. Also manual therapy is part of needed for treatment. And of course, electrotherapy, as we said, and hydrotherapy. These are the different modes of the treatment used by physical therapists.
So related to occupational therapy, if physiotherapy uses exercise as their main mode of treatment, we use activities. So for example, if we have a patient with hemiplegia, we would probably find out what is the most interesting activity the patient would like to do. So if his most interesting activity is like reading a book, then we would provide activities related to reading. Or if it's painting, we would give him painting activities. Or if it's, say, ball throwing or playing a football, we would incorporate the activities that the patient likes and prefers in his treatment sessions. So basically, activities have a very broad spectrum. So it can be self-care activities, academic activities, leisure activities, social activities like group skills, and so on.
Okay. The approach or target baseline. Okay. For physiotherapists, we are trying to identify and solve the impairments in order for us to overcome the disabilities. Okay. So, for example, we are training the muscle weakness, or if there is any tone abnormalities, or the patient is having pain, to be able to walk in order to reach the bathroom. But the main goal is to try to make him to walk as soon as possible, as independent as possible, with a nice and good gait pattern. Okay, this is an example. For the OT.
So if the PT's goal is for the patient to reach to the toilet, then what is he going to do in the toilet? So that would be our role. So we would look into, is the patient going to use his hand again to brush his own teeth? Or does he need a modification to use the brush? Or will he be able to sit in the commode of the toilet, or he needs a modification of the commode? Because patients have a lot of issues with their balance, with their strength. So probably he might slip in the toilet. So we would look into aspects such as modifying the toilet, or modifying the way the patient does these self-care activities in the toilet. So not only that, we look into other aspects like using the computer, using his tabletop activities like eating, and so on.
Does that make any sense for all of you? Yes. Okay? So probably the goal will be achieved, but we use different ways. Okay? My goal is to make the patient walk. Why? Because you want to go to the bathroom independently. Her goal is the activity himself. If he gets to the bathroom, what's going to do that? Okay? Specialities. Okay? For physiotherapy specialities, we have cardiopulmonary, we have neurology, orthopedics, pediatrics, oncology, sports injuries, women's health, older adults, used to be called geriatrics, and surgical, pre- and post-operative programs. For the OT?
For OT, also we have different specialties ranging from a wide lifespan. So some of them are common: neurology, orthopedics, pediatrics, oncology. We have some other like community medicine, mental health. Cardiology is still developing in Kuwait, but in other parts of the world, people are working on cardio patients as well. And burns, especially with related to hand therapy and splinting.
Yes. And for the subspecialties, you can see a lot of differences between the two professions. We give examples for physiotherapy: critical care, neonate care, cardiac rehab, burn management, hydrotherapy, hand therapy, spine management, scar and wound management, electrotherapy, lymphedema, renal rehab, and vestibular rehab. These are the subspecialties. For the OT?
So we have many subspecialties, and people have to go into extra workshops or training. For example, splinting is a specialty that would take at least a minimum of 1 month, where you have to work up on different types of splints. So we have static splints, we have dynamic splints, which are the common splints that most of you know, and there's also the type of splints known as functional splints. So for example, if a person wants to go back to his profession, which is fishing, and he doesn't know how to use both of his hands, we would probably provide a functional splint to be able to do that specific activity. So people have to go into subspecialties to be able to major what they want to do. So there's most of them, I think, you know, ergonomics is related with industrial OT, where an occupational therapist can go into the industry or a company and see what are the hazards that the patient or the person is facing, and would look into modifying these hazardous environments. For example, forensic science. So forensic science is a subspecialty in psychiatry where people would go into prisons and deal with different behavior issues and help these people to go back to normal life.